The hospital at the University of Pennsylvania is not some quiet community hospital. There's always something going on. It's important for you to know how and when to react and what your role might be in an emergency situation. Often, in an emergency situation, overhead pages will be the first notification you receive of an event taking place somewhere in the facility. The first step you need to take is to listen to the announcements and determine if the event is in your immediate vicinity. If not, carry on. If the event escalates or spreads, further announcements will be made. Otherwise, resist the urge to go to the affected area to provide assistance. If the announcement does indicate your area is affected, listen to the code to determine the type of event taking place. A code red means there is a fire. Code amber means an infant abduction has taken place or a child is missing. Code silver means there is a missing senior or patient. Code black means there is a bomb scare. Code gray indicates workplace violence or an active shooter. Code yellow requests that you shelter in place. As a volunteer, your primary job is to take your cues from the staff. Staff will provide instructions in the event of an emergency. In the event of a fire emergency, there are two words you must know: race and pass. Should you come across a fire emergency, your first action should be to race. Rescue, alarm, confine, evacuate. Rescue anyone that is in immediate harm's way. Then raise an alarm by either dialing 911, calling hospital security, or using one of the fire pool boxes. Next, confine the fire and smoke by closing doors and windows. Finally, evacuate. Ideally, you will be able to move horizontally across the complex until you reach a pavilion or building that is not affected by the fire, and then you can work your way down to the street level. Never use an elevator in the event of a fire emergency. Should you need to use a fire extinguisher to get out of harm's way, remember pass. Pull, aim, squeeze, sweep. Pull the pin from the fire extinguisher. Aim the hose at the base of the fire. Squeeze the handle and sweep across the fire back and forth until the fire is extinguished or the extinguisher runs out of fuel. Patient safety isn't just about physical safety. We are also responsible for the safety of patient data. Under the Health Insurance Portability and Accountability Act, healthcare providers are responsible for safeguarding any patient information from anyone not involved in that patient's care. Think of HIPAA like Vegas. What happens in Vegas stays in Vegas. What happens with the patient information stays with the patient. That includes their name, medical record, diagnosis, birth date, room number, and of course, their course of treatment. As a volunteer, you are permitted to know information about the patients you are assisting as long as the nature of the information is within your scope as a volunteer. For instance, you may know your patient's name so you can identify them correctly. However, there is no reason for you to share the names of your patients, even if the patient is a mutual acquaintance of someone outside the hospital and they are not treating that patient. When handling patient information, it is best to err on the side of caution. Do not discuss any patient information with anyone outside of the patient's care team in public places where you may be overheard, or make posts on social media. The hospital uses sophisticated monitoring techniques to track patient information. Failure to abide by HIPAA may result in financial penalties for you as an individual as well as for the hospital. Infractions will definitely result in dismissal from the volunteer program.